to trick your body. It doesn't allow your body to recover fast and not to move for you long term. But you know, it's all about changing your life in a way that makes it easy for you to do the right thing. A lot more about that later this afternoon.
All right, let's get started, shall we, everybody? For more on what we do, we're going to have some questions on orthopedics. We have Dr. Stephen Ramsey. You would raise your hand, please. Dr. Jonathan Phillips. Dr. Edward Becker. From Florida Dental Implant, Dr. George Mother. And Dr. David Pratt. And from Florida Cancer Specialist, Dr. Neil Wright. And Dr. Terry Stacy. And from Mount Pennsylvania, Dr. David Lampert. And Jim Truman is right behind you. Sorry about that. Right back. You have the first question.
Perfect. I think it's trick to the West Coast to look at some new research being done in cancer. And I won't give this an ever. And we will beat cancer, most cases anyway, in the next 5 years. Before I get to the picture of the product, it's not that we'll get rid of the cancer. For a lot of people, we are going to be able to get people to live with cancer and not die from that cancer. That's the reality. So, explain to everybody the whole cutting edge, and you're out there cutting edge, recognize our cancer and the ability for us to change the paradigm. Because most of us in this audience who get cancer, most of us will not die from this cancer. What we're looking at is we're finding out that cancer is a genetic disease, but our immune system holds it in check. And so what we've done now to improve our survival is we've done the screening. When I started practice 30 years ago, you see end-stage colon cancer present that way. I was screening yourself with mammogram, with skin testing, with prostate cancer. And then what we have, like the Florida Cancer Specialist, we have over 100 different research projects going on. So not only can we help treat cancer with surgery, chemotherapy, radiation, we take it to the next level. Almost 100% of cancer doctors, we trained in the big academic settings. We trained in the big ivory tower. And as soon as we leave there, we go down the street or we come home. We don't become stupid. We've taken that ivory tower research and we brought our community here. So we brought that intensity of service and care to hometown, to you, to our friends, to our neighbors. That's what we're really treating.
Thank you. I'm going to follow that. First of all, great. I found a breast cancer on the airplane. So I'm a big believer in screening. But I also have colonoscopy. And I think you need to have our arthritis to get to 50. Sorry.
I had colonoscopy at 50 with my wife squeezing me, and they found that I had polyps in 3 cancers. So I had no family history. I can't do the right things. It's one of the best tests out there, particularly today for most of us, because it allows you to find it and fix it at the same time.
So, Dr. Black, what else do patients do to increase their odds of being healed?
Have good genetics, which you can't do. But what you can do, what you must do is take charge of your life. You got to be responsible for yourself. No one's going to do it for you. They're not going to be your God, your king, or your leader. You have to put your healthcare team together. You find your doctor that you can talk to. You find your doctor who will help you answer your questions. And if not, reload. Get it done. That's what you really have to do, is take charge of your own healthcare. Besides, you won't hurt eating right. Don't drink. You know those things. But you take it to the next level, and that is your responsibility. And your doctor will help you do that. You can. One last question, Dr. Chamberlain. A lot of folks who had cancer scares or had cancer in their families know how difficult it is emotionally afterwards. I'm just curious now for post-care. How do you get people who are scared of life or just trying to recover from treatment that is required to get back to constant endeavor in between staff, physicians, alone.
Right, thank you, Dr. Kimball. You're talking a little bit about cancer and human, specifically breast cancer. Now we're here to talk about oral health, and I was interviewing Dr. Patrick last week, right? And we were talking about the relationship between your oral health and the rest of your body. And he introduced me to one of his patients, dialysis partner. And these two on stage, I posted a picture I would like you to go to. Take a look at the difference. You follow me on Facebook, the first time in the U.S. Okay? So this one came to doctors with periodontal disease and scanner surgery like that. In fact, started saying again. So not only did we look at it, there is a correlation. And you're going to see what happens before and after. Take a look at those pictures. And the first thing you see is the cosmetic center. I'm going to tell you, watch this for Wednesday night at 5 a.m. She's going to tell you the difference made in our lives. As is Dr. Patrick right now. Let's see what that says.
So, the periodontal disease is one of those diseases that, unfortunately, they don't even go out of the chest. And one of the diseases is non-family. And they are going to have these things involved. So, the red disease is a relationship. And probably, there's a lot of basic understanding is too much. So, it's really, really very, very disease. Unfortunately, dental patients, a lot of patients go through the learning care line and get here. But with some reason, the mouth is kind of messed out with heart response. And we went under that where patients, they don't have routine dental care. They may or may not know they may or may not cover routine dental care. Things that people should do on a daily basis. And when it comes to severe periodontal disease, there is code that some of the procedures can be done.
We always answer questions about periodontal disease because it's so constantly asked about it. People struggling with it. I always tell them to floss the teeth they want to keep. Only those teeth. Out there right now thinking about going to leave what they should or causing painful issues without any teeth loss primarily due to periodontal disease, not the cancer. What's your view through that situation?
Sometimes I think that we're doing a better job treating cancer than we are treating periodontal disease. 60% of the audience right here has periodontal disease, you don't even know it. So if you haven't been using dental floss, if you try to use dental floss and you have bleeding, this is what happens. That bleeding means that blood vessels in between your teeth are open, and the very bad bacteria that grow underneath the gum have an open runway in your circulatory system. So when that happens, just like the Tampa Bay Buccaneers coming through your arteries with their cleats on, they're going to do some damage. Those bacteria put little nicks in the arteries, particularly in the coronary arteries. And your body comes along and catches those with cholesterol. That's what starts this process of building up plaques, and that's why people have heart attacks and strokes. So we've got to take a really close look at periodontal disease. It's something simple. Maybe Johnson & Johnson needs to start selling a toothpaste with a package that will include manual instructions. Now you can't go online and you can get some information about how to flush your teeth and go use it. There's 10 different videos on how to flush your teeth. So take a look at this, start doing it, and if you're beyond that point, maybe you go to your brain. There's so many people who are afraid to go to the dentist, and we know that. Florida dental implants, and we see those people every day. And we're able to get them back to chewing. Most importantly, we're able to make them feel better about themselves, enhance their self-esteem, put a smile back on their mouth, so we can prevent that self-esteem issue, not being able to smile, people at work, family, just make you feel a whole lot healthier. It'll give you a much healthier diet, and you won't have to cover your mouth when you speak with your mouth.
On this, when they originally introduced you, at some point tried to go to this, and you didn't go because of fear. Well, this lady had been in the diet, she feared, but her disease was so bad that her options were limited. But there's a happy ending to this story. She had to take care of her, and then to talk a little bit more about specifically what some of the options are. She came to your office one day and all her teeth removed and had an implant put in. She said she didn't remember the surgery, and it has absolutely nothing negative to say about the whole experience. A month later, she's feeling healthy again. Talk a little bit about what the options are.
We're very lucky to create a dramatic change in people's lives in just one day. That's one of the implants. And if you're also wearing dentures or not wearing dentures because it's aggravating, if you have advanced periodontal disease or dental decay, we're able to treat you. And the first thing we do is overcome your fear. Any procedure you have done for periodontal implants will be under full general anesthesia. So you don't have to worry about hearing drills or getting shots in the mouth. You can totally asleep. And because of the technology that we have available, to include on the diagnostic side, a CAT scan is right in our office. So for $50, you can come in and talk with me for an hour and have a CAT scan. A CAT scan that goes to the hospital somewhere around $750. So, if you have a question about what you need to have done, you can come in and talk to us. So basically what happens is that you come in on the day of your procedure, we've already made the teeth that we're going to put in your mouth. Will be attached to the implants. And then we'll do anesthesia. We remove the teeth, put in the implants, and then fit the new teeth through your mouth. So you leave that afternoon with teeth that are actually attached to the dental implants. They're secure. You don't move in your mouth, and you're able to eat right away. So that's pretty amazing, all because of technology and the facilities that we have in Lincoln.
Once again, if you want to see the before and after pictures now, you can look at on Facebook. They're trying to do it. Watch my report Wednesday night. It's really a right? Exactly what he was talking about. You'll be before. All right, now let's do the topic of orthopedics. Dr. Beckman. Every year, over 300,000 Americans have first of all, I want to ask, how many of you guys put that top of your head? Your elbow, your back. I better give everybody in this room raise their hand. Your neck, right? That's all orthopedics. We're talking a little bit about different things. 300,000 Americans have different things. There's a lot of talk about minimally invasive surgery. How much less invasive is technique? What about the best?
Well, it's a newer way to do an open operation. A hip replacement is a new socket and a new ball. And traditionally, it would go in from behind or posterior or a lateral approach. An anterior approach is just a nice way of letting your main incision in the front. When you do it that way, the advantage to the patient is a quicker recovery because unlike the other approaches, you don't touch any muscles whatsoever when you're installing the device and staying here. So the main advantage is that there's no muscle being touched. Some of the traditional downtime associated with those muscles having to heal after the operation is minimized. So it's not the length of the incision, it's not what you do on the outside, it's what you do on the inside that matters. And with a hip replacement, we're seeing patients go home the same day, they don't have any dislocation precautions, and basically you're allowed to, if you will, get back into game as fast as you're able to do it, rather than a multi-month recovery.
One of the biggest movements in American health has been the physical fitness movement. And the reason it works is because we can give you things, we don't take things from you. Unlike a lot of other recommendations are often offered. But it does offer some challenges. You got to make sure you exercise the right way. And sports medicine is doing a lot, but sometimes we don't exercise the right way. So that's real. times do we see these sports medicine right now? They give folks some advice about the best thing to do. What are the things that one can be doing to ensure that in the simple things I will work?
So a lot of the trends we're seeing is there's a lot more people now that are taking charge of their health. And so a lot more people are getting out and they're moving. A lot more people are exercising. A lot of the younger folks are doing a lot more sports, a lot more baseball, especially down here in the Tampa Bay area. Now, the biggest problem that we see is a lot of people start exercising and don't have the plan. So when they start exercising, they start either walking or jogging or moving or they'll go to the gym, but they don't have a plan. So what needs to happen is people need to educate themselves, either by going to a doctor or a sports medicine specialist and speaking to them about moving forward with exercise and based off of their health history, speaking with them about strengthening particular areas that are weaker than usual so that you can prevent injury. We see a lot of knee, hip, back, shoulder pain, and so on when people started exercising and just sort of moving because they were told they have to keep healthy and keep moving. But without having a proper plan in place, without having a proper exercise protocol in place, you won't be able to strengthen yourself adequately and keep out of the injury.
Doctor, on that note, I heard a story on that particular program that you're talking about. A young girl in the area, hospital there, and she was suffering with a lot of shin splints. So she actually went through the program to have a hospital and made it to the whole soccer team without an injury. So all of that does really matter. However, as we know, moms who have young athletes, injuries do happen. They just do. And when someone gets injured, they really want a minimally invasive procedure. So, Dr. Becker, can you talk about what you guys have available for a hospital? Is there a minimally invasive?
Sure. As Dr. Phillips has said, our goal as physicians is actually to get people back to a healthy and active lifestyle. As a surgeon, my real goal is actually to keep you out of an operation. The minimally invasive surgeries, when necessary, are the next step. In my line of surgery, arthroscopy is very commonly called hip scope, shoulder scope, knee scope. But this is a technique where we can use small instruments, cameras the size of a pencil pen, and a couple of little incisions to look inside the device. And this can be basically used in every joint throughout the body. Our reason for doing that is less trauma cases, less trauma result tissues. We can hopefully get patients back to interactive lifestyle.
We shift gears. Yesterday was the birthday spread. It snowed in New York. We gave our show. One nice thing about that is you want to share your lifestyle. If you're lucky enough to live in Tampa, and any other big cities in this part of the country, you have to share your lifestyle a lot. I suspect probably 9 months of the year in these areas. That means a lot of you get subconscious about the veins in your legs. Especially veins you don't want to be apparently or visible in the legs. Variable veins, spider veins, kinds of veins that you see aren't just a cosmetic issue. They're actually food us. In fact, a lot of the things we sort of get embarrassed about are foods, what's going on deeper in our body. That's why we give you guys a hard time to show how the color of your urine is or what your poop looks like. I'm not trying to embarrass you, although sometimes that helps. But I'm trying to understand, that these are signs. If the gas or the exhaust coming out of your car was black and smoky, that's an indicating sign. So I want to talk real quick, if I can, about a wonderful experience taking care of veins and complicated process. Take a look at an idea of how veins are doing overall health and help understand what we do about it.
Thank you. We can do a lot these days to help you have younger legs. We got that motto from our patients. Without my legs getting younger, and they look younger, and they're healthier. And so, veins nowadays is not the same as your mother has. Veins are veins. All the procedures are minimally invasive. Treat the vein with laser on the inside and distributed out the surgery. Veins is ambulatory. Walk into the office and walk out. changed a great deal. Sclerotherapy is still used as old-fashioned technique that we still do. I have a lot of trouble with Dr. Oz because you show people getting rid of their fighter vein instantly, and you have the vein disappear. I want that Dr. Oz.
I'm going to come back to that point, because my idea is that I'm actually learning about today. I love these events, and I get to travel around and learn from the different gamers that are available. I'm going to ask you a follow-up question in a minute about a technique I guess you saw one of your assistants actually received from you. I didn't even know existed.
Maybe you talk a little bit more, I know lots of things over here, about the brain treatment, how much better it is today. Many times you have to do it, what is the Can you hear me? All right, Campbell Big and Dr. Oz. Well, I'm not a doctor, like all these guys up here. I'm a vascular tech. And one of the things that you want to do is you want to stay on the cutting edge of things. And what we do is different from a lot of places. All our ultrasound work is standing up because the problem is gravity and valve. And you can't have a valve problem laying down. You just stand up and show us
these breast cancers respond and are turned on by hormones. Others aren't. So if these markers are off, let's say you have a HER2 positive, explain to us what that means and how you might do it very differently because of that test data.
HER2 positive breast cancer, some genes in the cancer cells regulate growth. So the HER2 gene moves on signaling to trigger uncontrolled growth. They were able to identify a monoclonal antibody shut down the function of the gene. So the first one identified was trastuzumab, brand name Hurtado. It totally changed the prognosis for these HER2 positive breast cancer. Now, of note, some lung cancers are HER2 positive and some gastric cancers are HER2 positive. And so those are now able to be treated with trastuzumab as well. But advances have given us other monoclonal antibodies to target the HER2 gene. By combining trastuzumab with trastuzumab, the survival for patients with current breast cancer that is HER2 positive has been increased by 15.6 months. So we now have 50% of women with metastatic HER2 positive breast cancer living over 56 months. Not very long ago, that was unheard of. I think the story about that, but it is a pediatric reality. And we were interested in finding more information. Now, like I say, I'm using the top of the team because it's a real podcast. They're getting things around in the body. I have one friend of mine who's alive 4 years later. She was in hospice care. I don't know that. So that's amazing. What about the advances in therapy for estrogen receptor-positive breast cancer, which is different from what we treat? So about 2/3 of all breast cancers have receptors on the cancer cells for estrogen and progesterone. So these hormone receptors on the breast cancers actually behave better than the ones that are negative hormone receptors. And part of the treatment usually includes blocking estrogen in those patients. Tamoxifen is a drug that blocks estrogen at the receptor level, and that drug has been around and widely used for over 30 years. Now, after menopause, women still get estrogen by converting adrenal gland hormone to estradiol with an enzyme called aromatase. And so a class of drugs to block that aromatase enzyme were developed, and that includes anastrozole, letrozole, and echinacea. But what happens is those cancer cells eventually figure out a way to work around that medication and circumvent the effects and start growing again. So much research has been done to try to prolong the sensitivity to estrogen blockade. So a trial was done with echinacea and everolimus, a drug that blocks one of the growth pathways, and that showed a longer duration of benefit. Most recently, just in February, another drug was approved in combination with letrozole called palbociclib, and that has almost double progression-free survival when they're treated with letrozole plus palbociclib. Cleared them up, right? That's the information that can just go away because I've got the presentation you don't miss. It's at 1:30. We may have time to do about 3 minutes. All right? I want to say, go ahead, please.
I want to ask one favor. I love to do that because healers meet you where you are. This is how change happens, and there's 1,000 people there. So you don't have an obligation to go out and tell people what you heard today. You already got the message, that's why you're here. But there probably half a dozen friends you have who benefit from something you heard here or something else came out later on.